This is the note card I will be using for this presentation. My name is Carmen, and I'm going to be talking about the Medicare for All bill. Now, what do you do when you get hurt? You go to a hospital, of course, get the proper treatment, the proper procedures you need to get back in working health, right? But when you get out of it, you're charged all these bills, and there's a high amount of money put onto these bills as well. And now all of a sudden you're facing a big financial burden. And this isn't just something you face alone. This is something that almost every other American that walks into those hospital doors has to go through. Now, what can we do to solve and encourage people to go and get the proper health care they need? Well, Medicare for All has a solution to that, a possible one. Congress.gov explains on April 29, 2025, what the bill exactly does. It's supposed to cover for all U.S. residents to automatically enroll those upon birth or residency, and cover for all items and services that are medically necessary and appropriate to maintain your health. And now, what's the purpose of this bill? Well, PNHP on the same date explains that by eliminating waste and corporate profiting in healthcare, the bill would save hundreds of billions of dollars annually that could be invested into actual healthcare and more equitable health outcomes. And though this bill sounds all dandy, right, there's still problems with it. But before we get into that, let's go over one more pro. The Blade on March 21st, 2026 explains how it would relieve the burden of small businesses and large corporations paying for about 75% of health insurance for their employees. And they can invest this kind of money into their actual businesses and therefore be paying their employees more with the more profits they get, the trickle-down effect of an economy. Now, as I mentioned earlier, there are cons to this kind of bill. It will require tax increases on the middle class, according to the Washington Post on March 21st, 2026. And with these increases, there will be complaints. People hate not being taxed more because that's more of their money. And they want to know that their tax dollars are going to something they support. And a lot of people actually don't support this bill, according to the Washington Post, because it would require the government to kick over 181 people off their employee-provided insurance, 36 million off their individually provided policies, and 35 million off their Medicare Advantage plans, which a lot of people on surveys had said they like. And so with this kind of disagreement for where their tax money is going, there will be a lot of critiques. Another possible issue that could come along with this bill is that when comparing to other foreign systems like Canada and the UK that have these kind of healthcare bills, there's long wait times, especially for specialty care, because doctors won't need to specialize in something anymore. They'll be generally trained to help you with whatever health issue you have. And this can be a high concern because what if someone is in immediate attention and they can't get that? Now, another issue that Medicare for All will probably never solve, because it's honestly a U.S. and capitalist issue, is the health gap. According to PMC on December 31st, 2019, Medicare for All will not be able to deliver on its implicit promise of equal opportunity for the best possible health outcomes. And this is because it cannot erase the health disparities that are driven by wealth. People will automatically be able to get better health care if they are given more wealth or have that higher wealth. And now this isn't a solution that Medicare for All is really going to solve, even though it says it will attempt to. But some solutions we can have for other issues that would totally change the game for healthcare if we put it alongside Medicare for All comes from the Market Watch. The Market Watch explains 4 different kinds of additions that need to be added to this bill when employing it. One is to change reimbursement for the doctors to make sure that they're still being given something. 2, that drug companies must be extracted from the system because they control everything. And in their control, everything is driven by greed. Everything is done in order to get the most money out of you and not actually help you the most. 3, quality indicators for both doctors and clinical protocols to make sure that you are getting the proper medical attention you need and they're doing it well enough. And 4, more money and resources must be dedicated to nutritional and lifestyle programs, and all doctors must receive proper training in these areas. With proper training in these areas, we can ensure that doctors are trying to look out for the best for you and not just for the best for them. Because what a lot of hospitals are doing currently is charging you with whatever kind of attention you need, but in the most expensive form. Maybe they're adding a surgery you don't need or giving you medicine that you don't necessarily need, but it all racks up in order for them to get more money. Now, again, I think Medicare for All is a great bill, and I think it can do great things, but it does have a lot of empty promises that would be made if it is employed. And that is why it does need additional things in order to make it actually create a difference in our healthcare system. I think that Medicare for All is a great idea on the surface, but I think it has to go more in depth and actually unroot the problems that reside in capitalist America. Because the whole reason why healthcare is such a major issue is because it's become something of greed rather than something for actual health and the safety of our citizens. Thank you for listening to my presentation.